welcome to another episode of Coffee Talk with Encore. Today we'll be discussing modalities, how to most accurately bill and document in the medical record when our modalities are being used.
Yeah, so we all know that modalities are great and really beneficial to our patients across all disciplines for various reasons. But if we don't bill them and document them correctly, it can really have a lot of impacts, not only financially, but as well as having impacts for our license as a therapist. So the financial impact, we really need to make sure that the insurance providers, if they are reviewing our services, that they view our services as supported. So we need to make sure that they're medically necessary, of course, or they're not going to reimburse for those services. So we all know that the financial component is an important aspect of what we do. So it can really impact advocacy efforts. We need to make sure that our skills are viewed as valued and important and medically necessary, of course. So that leads us to the documentation aspect. So if therapists are not documenting well when they're using modalities, it can really put our license at risk. So not documenting skin checks, patient's tolerance to the modality that we're providing, and then of course have the patient's positive response can really put our license at risk. So we really need to make sure that we're documenting pre and post skin checks, any pain ratings, range of motion changes and measurements, those patient reports, of course. And then those are all vitally important to protect our licensure and demonstrate the value of what we do as it relates to our patients' progress.
So one of the keys to modalities is understanding that there's a few options. And when we're selecting the correct CPT code, that's going to make a huge difference in making sure that our services are reimbursed appropriately, because we have to pick the right code or they're not going to say that we met the requirements of the code. And I think one of the keys to that is understanding what the terminology means. So especially when you're looking at the eSTEM codes, you see attended versus unattended. And that doesn't actually mean that the patient's in the room with you or without you. What it means is, are you directing that eSTEM hands-on? Are you changing the amplitude? Are you changing where it's being positioned? And so understanding that that attended code is really only for that tap key or that manual on-off eSTEM. If you're using your traditional eSTEM with your electrodes, where you kind of set it and then you might adjust it once or twice while it's on the patient, but you're not physically there changing that electricity manually, then you should be using that unattended code. And the benefit to that is that you can walk away and be in the room with the patient, but treating another patient, and CMS recognizes that that's a supervised code. So you're allowed to go ahead and bill that other patient one-on-one for the treatment that you're providing, even though they know you kind of have an ear out for that patient that's on that modality while it's running. The other thing that I see that is a common billing error is when we're doing two things at once. So sometimes we'll use eSTEM, we'll use diathermy, we'll use ultrasound, and while that's on, we're doing something else with our patient. So we might be using ultrasound or diathermy for that thermal effect, and while it's running, we're using our other hand or both hands to be providing that manual skill for our patient. So we're using that thermal effect, but we're also doing joint manipulation, or we're doing tone reduction, or we're really diving into that contracture management. And we have to choose as therapists how to bill that time. So we can't bill it to two codes, right? So we have to pick, are we billing for that manual skill or are we billing for that modality? And I'm going to tell you, financially, it makes a lot more sense to bill for that manual skill. Same thing with gait training. We could bill that attended eSTEM code if we're using a button to turn the eSTEM on and off for a foot drop protocol while we're walking. But most of the time, it's going to be a lot more financially beneficial to bill for that gait training during that time, which is what you're actually doing with the patient. You're just using that eSTEM to kind of boost that. You also need to be really careful if you're using a wound code or not a wound code. So double checking which code you're billing and make sure that your documentation matches what you've built.
Good points, Becky. And we are going to dive into that documentation. When it comes to modalities, we want to make sure that our documentation is there. Like Ashley was mentioning earlier, not only does it protect ourselves as therapists and, our skill, but it also it's good for the patient, right? It's good for continuity of care. It's good for us to see if these modalities are beneficial or not beneficial. So we're going to start off by documenting the parameters. So what settings are we using on, the various modalities? We also want to document the patient's position so that we can see, was it beneficial using it in this position? Would it have been more beneficial maybe if we did something different? You want to document the location of the treatment. And also before and after, we want to document a skin assessment and or maybe a pain rating. So what did the skin look like before? How much pain were they in? And then what did the skin look like after? How much pain were they in after? Again, this can make sure that the modality is safe, that it's not causing any harm to the patient. And then with the pain rating, we can see if it truly is beneficial and effective for them. We also want to make sure that we're documenting the patient's response to the treatment. So how well did they tolerate it? What did they say about it afterwards? Are they reporting improvement? Was it beneficial for them? Just making sure that we're really having good, strong documentation when it comes to these modalities.
And those are all really, really good points. Obviously, all of that included in our documentation will certainly demonstrate the skill that the clinicians including within their treatment plan of care. And talking about the plan of care, including modalities in those treatment plans of care can certainly be of benefit to our patients in achieving their goals. But the big thing is that therapists really need to be consistently mindful of accurately coding when modalities are being used, as well as, making sure that documentation is being done in a manner that meets regulatory requirements and supports our skilled intervention. Well, we'd like to thank everyone for joining us today and listening in to hear our discussion on coding and documenting the use of modalities. And we certainly look forward to having you tune in again for our next episode of Coffee Talk with Encore.